welcome to a day with me in the gynecology ward. So firstly, what type of patients do we find here in the gynecology ward? So these are patients with any problem to the female reproductive system. So we can have females who are having miscarriages, incomplete abortions, or we can have patients who are having maybe cancer of the cervical or a tear of the uterus or the womb, anything related to the female reproductive system. So come along as I show you around the ward. So these are one of the rooms just behind me where we admit patients. So there's a toilet here, and yeah, we don't have to go inside, but yeah, come along. So I want to bring you to this special room. This room is called the manual room. So come inside. So we have this special chair here. This is where the patient lays down, and then they put their legs here. So in this room, this is where we do screening. So perhaps the patient came in with bleeding or an incomplete abortion, and they probably need a screening before they go to the theater. So they'll be sent, as they come to the ward, they'll be sent to this room, and the doctor will view depending on the condition. So usually, normally a patient will come in with probably a bleeding or a pregnant woman, then perhaps they're not yet due to deliver, but then the water broke, or they're experiencing some cramming, or bleeding, or whatever it is, in that area. Before they go for sonar, they'll come here for that screening. And so yeah, the patient will lay down here on this bed, and the doctor will do the screening. So in each gynecology ward, you'll find this room. It's called the manual room, where they do all the screenings for many emergency patients who need to go to theater, or perhaps they don't need to go to theater, but it's an emergency that time to stop the bleeding, or whatever is going on for that moment before they're sent home. So yeah. So we have the rest of the different rooms over there, and just behind me here, we just have delivery pads packed up here. Probably a patient, will require one. We just get them from here, but yeah, we'll pick it up later. So this is a ward. It's big. This is the isolation side. So here we can have, it's time of COVID now, so we isolate patients here. And then the other side we have rooms up to 8, and then you'll find like 5 to 6 patients in a room. So yeah, this is a little tour, and hope you enjoy. I'll see you in my next video.